Good morning. I am Curtis Rigney, and I'm honored to present to you a protocol of a mixed methods cohort study looking into reasons for early resignation from the chiropractic profession. But before I get started, I just want to make sure it's up there. I want to express some gratitude for the Southern Cross Postgraduate Association for organizing this conference and facilitating me to participate in it. And that includes Shay Brown, the committee, and the staff members. So I really appreciate it. And it's nice to put faces to all the names. I also want to thank the Faculty of Health and their graduate school and the library staff for supporting me in my research endeavors. My PhD has been a bit of a challenge, both intellectually, psychologically, and emotionally. And I'm extremely grateful for my fabulous supervisors, Professor Sandra Grace and Joe Bradbury. They are extremely wise and experienced and empathetic, and their support has been fantastic. And of course, I want to thank all of you for being here in my presentation, and of course, my biggest fans, my friends, and my family. Today, I'm going to be sharing with you the inspiration for my research and the aims of the research, background that supports the methodology that I'll be using, the methodology itself. This is just a portion of my PhD. In particular, we'll be talking about how the survey, the instrument that will be used, will be put together. And before I conclude, I will discuss some of the possible significances of the research. So I'll never forget my first day of chiropractic school. I'm a chiropractor, by the by. And I was sitting in an auditorium filled with my classmates. There was like 180 plus of us there, and a parade of administrators and academics were being introduced to us. And Professor Tony Tran said to us, he asked us to look around at one another, and he said that 5 years after graduation, 70% of us will no longer be in practice. I don't remember the stats, where he got those stats. I don't know why he even said that, but I never forgot that. And as I traveled around teaching across Canada, the US, and Australia, and then in Bournemouth, England, I would ask academics and clinicians alike if they heard similar stories about the attrition rate within the profession, and many of them had, but their range was from 50% to as high as 80%. So why is it, I mean, if this is true, it seems kind of a bit of a concern why people who have spent so much time, money, and effort to become a chiropractor and maintain their license, why would they leave the profession? So that leads me to the aims of the study, which I'm just going to make sure I read it carefully. The first is to identify underlying causes for professional resignation in a cohort of 2010 Australian chiropractic graduates, and to compare the attitudes of those who leave the profession with those who have remained in practice. So I did some background literature review. A lit review was performed to look at the rate and cause for attrition from the chiropractic profession. And 5 databases were used to search. We were looking for peer-reviewed papers that were published between 1991 and 2021. The keywords that were used were chiropractic's not there, but obviously chiropractic was there. The resignation, attrition, non-practicing, voluntary departure, and burnout. I think it's important to define these search terms. Attrition is just leaving the profession. There's many reasons for attrition. There's death, there's disability, there's disciplinary action, there's retiring, and resignation. Resignation is a voluntary departure. That's just another term that's used. And the term non-practicing is a category of individual that may choose to maintain their license or registration even though they're not practicing. These individuals tend to be like academics or researchers or perhaps board members, people who feel like it's important to maintain their license even though they don't practice. Burnout is a psychological condition that might lead someone to choose to resign or to leave or retire, but people can continue practicing even though they might be suffering from burnout. That's important to recognize. So 108 papers were identified in the search, and then after going through the process of removing the duplicates and titles and abstracts in full papers, 3 papers were met the inclusion criteria, only 3. 2 of them were on attrition, and 1 paper was on attitudes of non-practicing chiropractors. All 3 were retrospective observational studies. So just to, what I found from these few papers was from the attrition point of view, their results did not match the rumored extremes of 50 to 80%. So the Lance paper found as low their rate of attrition from their population, which happened to be from graduates from 1 school, Life West Chiropractic School, which is now a university that's in the Bay Area of California. And from their research, they reported 4.5% attrition, so it's much lower. That happens to be more in line with other healthcare providers in their professions. Foreman was a little bit more expansive. Foreman and his group, they looked at attrition from chiropractors, licensed chiropractors in California. So it was limited to Californian chiropractors or chiropractors who had a license to practice in California. And their highest rate of attrition was 25%. So that was kind of good news for me to kind of, at least at first glance, to see that it wasn't as extreme as it's been reported or rumored, anecdotally reported. But still, that was a limited population that they were looking at. The paper that looked at attitudes, and that was more like the reasons for leaving, they used a survey instrument. That survey looked at different factors that may relate to the profession and stresses within the profession that may relate to or make that decision to leave practice. And I was just going to report the highest, that item in their survey that had the highest level of agreement, 83%, that chiropractic was not a profession that was easy to make money. It was not easy to make money in the chiropractic profession. That was what that item had the greatest level of agreement. So that supports this finance issue, financial concerns, stress. A quality concern about this paper was that with their population, they surveyed individuals that were members of a chiropractic skeptics forum. So seems rather obvious, but and then they didn't perform power analysis. They did say it was a pilot, so I appreciate that. And the response rate was quite low. So they were quite guarded in their report, but still they're the only ones who actually surveyed people who may have been chiropractors that left practice, but we don't know who they were really. So those were the 3 papers. And so that leads us to my research proposal. We're going to be looking at graduates, so we're trying to get a bigger cohort here, 2010 graduates of Australian chiropractic educational programs. The reason why we selected this cohort is, it's pragmatic to have a particular cohort instead of trying to capture all chiropractors. But this cohort is representative because they represent all of the graduates at that time. And this is the first year that the graduates would be registering in a nationwide registration scheme, so that we would capture the whole nation rather than having to go from state to state and try to capture it like that. So that's the APRA, the Australian Health Regulation Agency, Health Practitioner Regulation Agency. So we're going to try to identify the potential participants in this study by going to the institutions themselves and getting lists of their graduates from the alumni organizations, and then their contact details. We'll use the APRA database and professional associations, social media, and hopefully capture through snowball effect the peer network, try to capture those individuals who aren't within these databases and these schemes, and perhaps individuals who've left the country to practice elsewhere. So trying to capture as many of these graduates as we can. The questionnaire will be in 3 parts. There's the demographics, and part of that will include their practice status. And then we'll have Likert type questions as well as open-ended questions. The qualitative data will be analyzed thematically, and the quantitative data will be analyzed statistically. I forgot to mention that the questionnaire will be piloted through asking practicing chiropractors and non-practicing chiropractors and academics to help through the process of honing down that questionnaire. And these will not include the 2010 graduates. Okay, so the survey that will be the main instrument here will be informed by essentially 3 points of information: the literature that identifies those stresses, that the financial stresses experienced by chiropractors, and the belief that these financial stressors contribute to the decision to leave the profession. These financial stressors have to do with this belief that there might be too many chiropractors being graduated and entering into the workforce, and not meeting or exceeding the ratio of doctor-patient ratio, where those people, the general public who utilize chiropractic services. Too many chiropractors, not enough patients. That's a belief and a concern for chiropractors. There's also this appreciation or this idea that people have a higher expectation of an annual income, and it's maybe lower than what they expected. And the cost to go to school is always increasing, and that also means then your student loans are increasing. You have
So
to
that's
pay
about
more.
14 minutes.
4 minutes?
That's about 14 so far. So
Okay.
a minute or so to go.
Okay, thanks. I appreciate that. Okay, so the survey is the survey that I spoke about had 4 domains: education, and that could be did the graduates get enough preparedness for practice, financial, which we talked about, psychological, I mentioned burnout as a possibility, and then also political. If you're unfamiliar with chiropractic, there is this split within the profession, and just very basically, simplistically, that split is kind of like this focus focus on research and science, and other focus being on philosophy. That's a simplistic view of that. But excitingly, what I think is most, what I'm most excited about is that this survey will be informed from data gleaned from semi-structured interviews with non-practicing chiropractors that are not from the 2010 cohort. Okay, so this process of profession looking in on itself and looking at possible issues, concerns, to reflect on its own practices and its own behaviors is a valuable exercise, and it can build public trust within the profession, and building public trust is a part of a profession's cultural authority. And so we can enhance the chiropractic's cultural authority by having research that is self-reflective. And of course, the data can inform education, politics, and regulatory bodies. So just to conclude, this attrition research is extremely challenging. I'm up for it though, but it's extremely stressful, and but I'm excited about it. And we'll see if finances is a key thing, or maybe there's some other aspects like having to cope with clinical uncertainty. Any questions?
Well, thanks very much, Curtis. That was really interesting. And I think you can appreciate that with only 3 main journal articles in the field, that leaves you with a wide open field, which it can be scary, or depending on how you look at it, very reassuring. So does anyone have any questions for Curtis?
Curtis, I had a question about if you're in these early stages seeing any trends between chiropractors who are self-employed and chiropractors who, the attrition related to chiropractors who are self-employed and shutting up shop, and chiropractors who are working for a larger organisation.
So chiropractors typically are self-employed, and they might work in a larger private practice. And if they're working for a larger corporation, they're usually not practicing. They're reading through case files and for insurance, and they're operating like that. So chiropractors aren't in hospitals typically, and so that's an uncommon thing. The vast majority of chiropractors, if they're not in academia, not in research, they are in private practice of some sort. So we'll see though, because we'll in the survey, this kind of information is hard to glean, but that's an excellent question. Thank you.
Yeah.
Thanks, Curtis. Just a comment, as you say, I haven't seen studies of this nature, so I'm looking forward to what you dig up.
Thank you. Yes?
So just your Prism and flow chart right at the end, did it say that you had excluded papers about burnout?
Yes, I did, because it was talking about burnout as a psychological condition, and it hinted at that could relate to attrition, but it wasn't on attrition. It was basically about the condition of burnout. So my focus was on attrition and leaving the profession. That's an excellent question, and that does come up quite a bit. I appreciate that. Yes.
I found your presentation very professional. The way you put it together, the amount of slides, the way you communicated what you wanted to present forward, and actually, I don't understand much, but you took me through this journey where I actually came out with something that I probably would never have looked into. So thank you.
Oh, thank you very much. I appreciate that comment. It's very kind. I would like to just add a little something if I have time. That literature review is I've submitted it for publication, and it's been accepted with, but not accepted with revision. Let's be honest, major. But 6 reviewers have responded to it, and my thing, and I was told that they send it out to many reviewers, hoping to get 2 or 3 people responding, but apparently this topic was so intriguing by the reviewers, they all responded to it. So now I have 6 reviewers to answer to, but I'm supposed to be honored, but I am honored by your presence today.
Well,
Thank you.
congratulations. I think you're up to a really good start. And I'm sure, look, in your field, this is a really important question. As you said, it's under-researched. I think you're going to make a significant contribution to an important area in your profession.
Thank you. I appreciate that.
Thanks very much, Curtis.
Thank you.